Hello everybody, my name is Mona Chiso. So today I'll be talking about today I'll be doing the Unit 3 seminar on 669. So I'll be talking about a clinical an interaction I had with a patient during this clinical rotation. And I will be reflecting as I'll be reflecting on my role as a psych nurse practitioner. So during this clinical rotation, I met this 34-year-old lady. So when she came in, she was really very irritable. She was delusional. She was paranoid. She had like extreme behavior. Her voice was very pressured. Her speech was very pressured. Her voice was very high. So when I met her, I did introduce myself to her, but she wouldn't talk to me. She wouldn't talk to anybody else. She was really she was like I would say super excited. Like she was really super excited, very delusional. So when we tried to get information from her, she wasn't responding. So at some point I paused while she was in the office. Like I paused, I tried to I offered her a cup of coffee. I asked her if she would want a cup of coffee. So she looked up and she said yes, she would want a coffee. Before she said yes, she said to me that people think I'm crazy, but I'm not crazy. I just have a special kind of behavior. So when she said that to me, so I said, okay, I was gonna get a coffee for her. I asked her if she wanted a creamer or a sugar, something like that. She said, yeah, she wanted a creamer. I went and made a coffee for her. Then I brought it to her. So she was really excited. So then I got into conversation with her. We started talking. So when we started talking, I started asking her questions. She was telling me, giving me histories and things like that. So at this point, I had a reflection about this role as a psych mental health nurse practitioner. So it's got to me that at some point I might need to have patience. I need to exercise my patience with my clients, because sometimes these patients, like, you know what the psych mental health problem is, so you really have to be patient with them. You really have to be non-judgmental with them, so that they'll be able to develop that trust. You'll be able to develop that rapport with them. So, coming about psychopathology and the patient-provider relationship. So understanding the fact that when she came in, she was really very irritable. She was delusional. She was actually saying things. So I got to know that, and at the other point, she became moody. She was answering to me. She was giving me information. So I realized that this woman could be experiencing bipolar disorders, where people experience extremes of behavior. People could be very irritable, anxious, catatonic on this end, and in a little while they swing into depression, or they swing into a better mood. So I did realize that probably that's what she's passing through. So that's where the knowledge comes from, the knowledge of psychopathology, like knowledge of disease condition of psych. So again, it's patient. Talking about the provider-patient relationship, I believe that, like I said, I brought in my patient ability to be patient with my patient. Also, like, I was really very empathic with her, because at all times I think mental illness could happen to anybody, so they should be treated with kindness. That was why I said, wait, on it, I had to offer her a cup of coffee. That would make her to calm down if she's a coffee person. So sometimes we have to go extra miles just to have that relationship, because having a good relationship with a client or a patient forms the basis of your care, because a patient that is happy with you can do anything for you. Even when you're doing the wrong thing, they can give you information, that can give you a good feedback. They can, something like that. So the relationship forms like the basis with the patient. Talking about my strength has been empathy. I have been an empathic person, even, like, which is something I bring into the clinical area, because at all times you have to feel, what if you are the one this thing is happening to, how would you feel, so that is one of my strengths. So talking about the use of self, so I was very patient with this patient. I was very kind. um I was very empathic with her. So all these things, I used it as a kind of therapy. I used it as a kind of way to like get her to answer my questions, get her for me to have access to treat her, you know. So applying this in as a future psych nurse practitioner. So I'm just trying to reflect. So I am reflecting on the fact that having a good I will like having a good relationship with a client or with a patient forms the basis of your treatment, form the basis of your job. At all times, I will have to try to have a good relationship with my patient. I will always try to make them feel comfortable to open up to me, because that could actually make or mar a visit, a patient visit, or a patient's admission, or things like that. So I believe that I will be reflect like from time to I will try to make building relationship and rapport as my priority, while looking after patient, while seeing patient as the future nurse practitioner. Also, at all times I will have to reflect on the qualities that has helped me, on the strengths that has helped me, on my strengths and my limitations. I at all times I would always like improve my knowledge about psychotherapy. I'm sorry, my knowledge about psychopathology. That will help me to pick diagnosis very early and establish a treatment plan. Thank you.